And I can remember as a grad student back in 1973, where we're talking about for the physician shortage still. Right? So the physician shortage has always been around, right? And what Medicare and the federal government and third-party payers have tried to do is deal with it from a reimbursement perspective, but not within the context of the demographics of the population, right? And so the reimbursement model is really driven around what I would call population needs. And so as we now move the clock forward, we're seeing the need for primary care, one being shortchanged, right, over, when Medicare was started in 1965, and now we're doing course correction in a much more complex environment today. And so so now you need more primary care physicians, you need to adjust the reimbursement systems, but you also need to improve the support for primary care physicians because the nature of the patients today are far more complex than what they were back in 1965. Right? Our life expectancy is so much different today. The needs for chronic and managing chronic conditions is so much greater today than they were back in 1965. And so now emerging, right, our systems and creating systems of care, working in alignment with and increasing alignment between physicians who are predominantly in private practice and now aligning them, right, with the health systems and really providing a delivery model of care that's far different than the cottage industry of 1965. So what was a significant policy decision, right, along with funding support with the enactment of Medicare in 1965 along with Medicaid, drove reimbursements that created a disproportionate number of specialists relative to the need for primary care. And so we're seeing this now shift occur. It'll take a long time to increase the supply of primary care physicians. Now remember, when the Affordable Care Act was enacted in 2010, it didn't have a one-year implementation. The implementation time frame was projected to be about 10 years. Well, I'm sure it's probably going to take longer than 10 years to implement all these solutions. We're now in 2016, going on 2017, right? And we're still far away from where we need to be in terms of being able to deliver care at the front end as the Affordable Care Act intended. And it's clear that independent hospitals, particularly small hospitals, are having increasingly difficult time to meet all the requirements that are needed, whether it's investments in IT, investments in technology, investments in expertise that you need. I'm talking about human expertise that you need now to manage, the delivery of care. And so a lot of small hospitals have sought bigger partners, larger systems, whereby the support from the larger systems can go to these small institutions where they're not bearing the full cost, nor can they afford to bear the full cost of providing that kind of support. The systems have grown primarily in response to really this growing cost, but also the growing demand. And I think that's really where the nature of healthcare is heading. The healthcare system, and certainly we as Queens, are faced with issues that go beyond our control. Okay? For example, the homeless issue, right? And having to deal with that. And how do you deal with that before they become patients, right, that use hospital services? And you, of course, did that story on the homeless, right? And 64% of the homeless encounters in hospitals in Hawaii occur in a Queens hospital, right? Whether it's here or West Oahu, but primarily here on Punchbowl Street. And we, we as hospitals, right, have to deal with that because society has not been able to figure out a solution that would mitigate that problem. But I think there has to be recognition that if you deal with these issues before they become medical issues, right, you can mitigate this cost of healthcare, right? And I think there's a failure within our society, within our country, or within our state to recognize that there are needs that should be dealt with that ultimately get reflected in the cost of healthcare. There's a need to deal with the needs of the increasing geriatric population. And how do you deal with the needs of the elderly, right? Especially for those elderly that have no families to support them. the support system is lacking. Eventually, those things get reflected in healthcare and the cost of healthcare. You know, and we can't respond fast enough because we don't have all the resources that we need. But really, what should be done is to manage those issues before they become healthcare problems. I mean, this is really what I think we would like to see as healthcare systems and as providers. And you can, now, having said that, now that you have these issues, right, then you create the delivery systems, right, the support, you know, of those needs through the doctors and the nurses and social workers and all of that, right? Those entail costs. They have to be covered in some way, right? But I think if you recognize, right, that a good part of the healthcare costs that we experience really is the societal tax that's levied on the healthcare system, right? Because of failure to deal with issues that ultimately present themselves as healthcare problems.